Hi, my name is Candace. I'm the Assistant Health Information Management Director at Spring Hill Medical Center. My primary goal is to make sure each patient that comes to Spring Hill has an accurate and complete medical record. On a typical day, I'm challenged with being a departmental manager as well as the custodian of data and information that manages from the scanning of documents created during the patient visit to analyzing the chart for accuracy according to the Joint Commission and other regulatory bodies, to the proper coding and billing of each patient encounter. In the HIM world, every day is unpredictable and every day is different. One moment I'm dealing with physicians being placed off staff. The next minute I'm dealing with a billing or a coding issue. Patients also have the right to request an amendment or a change to their medical record. I accept complaints, and I also manage from womb to tomb. I manage everything through the record process from birth certificates to death certificates, so every day is different in the world of HIM. A core component of my job role is making sure that physicians are accountable for the accuracy and completion of each medical record. Monthly, we analyze all the charts for deficiencies. Another important key component to my job position is abstracting and reporting all trauma cases to the state trauma registry. My typical working hours are Monday through Friday, 8 to 5. Most HIM positions are salary. If I were giving advice, I would certainly recommend a student to either consider a 4-year program or a 2-year program accredited by the American Health Information Management Association. The 2-year is a registered health information technician, and the 4-year is a registered health information administrator. Both of those are great degree options for you and certainly should be considered before entering the career of an HIM professional. Another great option in the healthcare field is something called a CHPS certification. I currently hold this certification, and that stands for a Certified Privacy and Security Professional. It's very interesting in the world of HIPAA compliance, and it's ever evolving. If you're interested in protecting the privacy of your patients, consider getting this credential. Again, a CHPS, and that's a credential issued by the Health Information Management Association. I suppose the best and worst part about being in the health information management field is that there is no more challenging atmosphere than today's ever-changing healthcare environment. You got to be open to change, and you got to roll with the punches and really enjoy an ever-changing environment. Or I'm afraid you might not be happy in this position and run out screaming. The evolution of healthcare is changing with the push for more interaction with patients through the use of an electronic health record. That means more regulatory compliance to come and an ever-changing healthcare environment for you to participate and perform in. When students come into the department, I always find that they're actually surprised at our healthcare environment. There's some surprising things. You got to be a people person, and you absolutely have to be a perfectionist. One mistake in healthcare could cost a patient their life. It absolutely has to be perfect. We strive very hard to make sure every medical record is accurate and timely. There's a process for changing and correcting errors, but it's got to be almost perfect every time on the front end. With every patient encounter, there's a demand to get it right absolutely every time. As a student, you should make yourself aware of the current headlines. Subscribe to some of the IT blogs and IT serve lists to keep yourself aware of what's happening in your environment. As you complete school, I know it's hard, and I know you study a lot and stay in books, but keep up to date on some of the current things happening that may impact your field down the line. If you're aware of what's happening and what's coming down the line, you can make more use out of what you're currently studying, and you can also think about, how can I change this in the future? Is this a great regulation? Would I want to change that when I become an HIM professional? Always be mindful of what's going on and where the future of your, dream career is headed.